Welcome, everyone. We're excited to have you join us with our webinar today. Mary Hannah, are we going to share slides? And then we have so Mary Hannah is helping to facilitate the Zoom logistics with the University of Washington. I'm Brad Kramer. I'm in Seattle. I work at the health department, the public health department, Seattle King County. And I manage a climate and health equity initiative. Today we're meeting around early warning systems for extreme heat events. Speaking more broadly, I think we're going to get a range of perspectives across where health departments and health agencies are at with their addressing heat events I wanted to cover a few housekeeping pieces, and then I'll give you a little bit of background on how we got here today. So for housekeeping, we are recording, and there's closed captioning. We have the chat set up right now. Everyone is introducing themselves, saying their name and their role and their location geographically. You can continue to do that, but we're going to turn the chat off just after my introduction. The Q&A will remain active throughout the entire webinar, and you can use that to enter your questions, and I will facilitate questions and answers at the end after all three regions have presented. But we've had experience in the last webinar where folks were answering Q&A live during the session. So you can feel free to use that throughout the webinar. And then please stay muted, and we may mute you if you come off mute, just to avoid interruptions during the speakers. But you're in control. You and the hosts are in control of that. So we're not intending to silence you, but you may be muted, just to keep things moving. So how did we get here today? We have formed what is currently being framed as the Collaborative on Extreme Heat Events. That's how we initiated, and that's what this webinar series is about. But we have largely convened around climate events that are coming, that are asking our health agencies to step up and to be involved in the response. And we saw, so we had our last webinar featuring the firsthand experiences from the 2021 heat dome. This is our second webinar. We are health agencies from across the region. If you can, yeah, thanks. If you can go back to the slide 2. We are health agencies from across Oregon and Multnomah, Portland, in King County, Seattle, in Washington, and then in British Columbia at Vancouver. And then we are funded through a University of Washington initiative that was with the Bullitt Foundation to launch this and convene this collaborative for 1.5 years. And so we do have our academic research partners here too. Okay, next slide, Mary Hannah. So the collaborative, the goals are to establish a network between these practitioners and academics to realize potential partnerships. We realize that climate is local, but it's also regional, and that we have some collective experience that we could benefit from. And I find myself wanting to reach out and pick up the phone to ask my peer urban areas to help when we are responding in climate events. And so that's how the collaborative formed, is this desire to convene and to set a common set of action items, things that we can collaborate on and grow together. And so our goal is to end with an action agenda that's practice oriented. But we've also asked our academic partners to join us, and we're an academic health department, and we've been very successful at partnering to enhance and have higher quality and research products that come out of our collaborations. And so we're also setting a research agenda. Over the next 1.5 years, we have several convenings, and this is slide 4, Mary Hannah. And so we're at webinar 2. we decided to have a series of webinars that will sort of give us a collective history to share and form this collaborative on. And so you'll see another webinar coming in February and then a fourth in March. And then we're going to convene a broader half-day. We haven't figured out the full logistics of the date, but in April, I believe, a spring 2024 workshop. And the idea of the workshop will be a series of working sessions. It will be virtual, and we will land on an action agenda for practitioners, as well as a research agenda. So next slide. So today's webinar is again around early warning systems for extreme heat events. And again, it's across the spectrum of experiences, including setting thresholds and activating. And then we'll have questions and answers for the panelists, and then breakout rooms at the end with the speakers, so you can have a little more dialogue. We will also, before convening, we'll also share next steps and review the webinar series and upcoming activities. Next, so our speakers today are starting with Vancouver, British Columbia, Dr. Sarah Henderson, moving over to King County, Seattle, with Reid Wolcott and Addison Houston, and then moving to Multnomah, Portland, with Julie Sullivan-Springhetti. Without further ado, I'll start with Dr. Sarah Henderson.
Great, thank you very much. And thank you for inviting me to be here today. I'll just go ahead and share my screen. And it should be that one. If you can confirm for me that you're seeing the slides. Wonderful. Okay, I'm sorry that I missed the last webinar. I really would have liked to hear more about the experiences outside of BC. I'm very familiar with the experiences inside of BC. I've been leading the province-wide research on deaths during this 2021 heat dome, but I want to give you kind of a broader perspective on warning systems in the province over the past decade or so. So I've been with the BC CDC since 2010, and one of the first projects that got put on my desk was to start thinking about a warning system after a deadly hot weather event here in 2009. So, first question, how many deadly extreme heat events has BC experienced in the past 20 years?
Sarah, are you able to see the poll responses, or do you want me
I
to?
am, and I'm able to end the poll when I think necessary. So I won't wait for everyone to answer, so we can move through quickly. I'm going to end it here and share the results, and we've got a pretty even split between 2 and 5. I gave you a little bit of a hint in my introduction there. We've had 2. So we had one in 2009, and then 2021 was took us beyond far beyond what we saw in 2009, but that's kind of the totality of these deadly events that we've seen in the province. We expect to see more in the years ahead, obviously. So I'm going to start with this 2009 event, and this was really focused on the Greater Vancouver region. There were some impacts elsewhere in the province, but I know we're also mostly interested in Vancouver here today. And a couple of things to point out to you here. So on the sorry, there's a whole bunch of things beeping at me while I'm presenting. On the red line here is the daily maximum temperatures in the Vancouver region. And I've always struggled talking about this event internationally because the daily maximum temperature reached 34 degrees Celsius, and I don't even know what that is in Fahrenheit. I'm sorry, for 2 days in a row. And that's actually not very hot by international standards. And we faced a lot of raised eyebrows when we went out there and said, well, even temperatures that are this mild internationally had a pretty big impact on the population. So we had about a 40% increase in mortality over this 7-day period, and you can see that the deaths, nicely tracked along with the increasing temperatures here. And again, one of the first projects that got put on my desk when I arrived here was, well, we need a heat warning system, at least for the greater Vancouver region. What should we do? And so I took data on mortality for the region and temperatures for the region and kind of a long history of what went on. And we eventually came up with this recommendation. A heat health emergency, that's what we were calling it, should be called tomorrow whenever the average of today's 2 o'clock measured temperature and tomorrow's forecast high equaled 34 degrees at Abbotsford Airport, which is a little bit east of Vancouver, or 29 degrees at Vancouver Airport. And the emergency should be sustained for as long as either criterion persists. Now, this isn't exactly what was implemented. We backed off this language of heat health emergency and agreed on calling it an extreme heat warning. But otherwise, this was implemented in 2012 and existed for quite a while. You can see here that as of 2014, this was the status of heat warnings across Canada. Until we implemented this in BC, there was nothing. And then the rest of the country received a heat warning when the humidex, which is a Canadian measure of apparent temperature, was going to be over 40 degrees for more than 1 hour. So, a very blunt instrument that we're using across the country. And then in 2018, Environment and Climate Change Canada, or ECCC, and the Meteorological Service of Canada said, we need to update this. We need to modernize heat warnings across the country. And we at the BCCDC were engaged in that process and asked to develop recommendations for heat warnings in 5 different areas of the province. So you can see this is our very hot southern interior, our northern areas. Vancouver is actually in this kind of lime green area, and then the Fraser Valley region here. And we put forward those recommendations, and they were implemented in 2018. But the old system was maintained over top of this new system in the greater Vancouver area. And we made that decision because the old system was really designed to capture very dangerous temperatures, whereas this new system was designed to capture temperatures that certainly had significant risk associated with them, but not sort of that catastrophic mortality that we had observed in 2009 and that we believed we would observe again. So while ECCC was monitoring these temperatures for us, the Vancouver region and the BCCDC continued to monitor our extreme heat alert criteria over top of what ECCC was doing. So we had 2 different groups of people looking at different types of alerts. And then the 2021 heat dome came along, and a heat warning based on the ECCC criteria was established. And our criteria that were sitting over top for the Lower Mainland were also triggered. And whenever that happened, we would have a meeting early in the afternoon among all of the stakeholders in the region to decide on how to proceed. It had happened a few times before, but in previous circumstances, there had been reasons why we decided not to ramp up a response. In a couple of cases, there was a lot of wildfire smoke in the atmosphere, and that was reducing the solar radiation. And in some cases, we could just not have quite the degree of certainty in the temperatures that we wanted to sort of start initiating an emergency type response. But this situation was different. And I'm just going to read an excerpt from an email that I sent after that meeting on June 25th, 2021. This has been subjected to multiple FOI requests, so I'm happy to share it with you. Please note that the Lower Mainland has reached its heat emergency alert threshold. While the threshold has been met a few times since implemented in 2012, the region has previously decided to de-escalate based on the weather forecast. This time is different. At the 2:15 meeting, ECCC made it clear that we are facing record-breaking and unprecedented heat over the region in the coming days. And at this point, we all knew that we were up against something very dangerous. Question number 2, how deadly was the 2021 heat dome in BC? 100 to 200 excess deaths, 600 to 800, or more than 2,000? So I'll end it there and share the results with you. Lots of people, I'm sure, attended the last webinar, and I'm sure my colleagues did discuss this, but we had the BC Coroner's Service say that there were more than 600 heat-related deaths, and then statistically speaking, we estimate there were about 740 excess deaths over an 8-day period, and that's about a doubling of population mortality. So a very large impact for the region. And here's what things look like. You possibly have seen this plot before, but in BC on any given day, we have a pretty steady number of deaths. It's about 110 with a standard deviation of about 15. Anytime you see a bar that is not green, that means there's a statistically significant deviation from what we expect to happen. And then during the heat dome, once again, similar to 2009, though this is for the entire province, we see these temperatures go up, and as the temperatures increase, we see mortality increase. Indeed, the day of maximum excess mortality was the day following the hottest temperatures, and that's quite typical of these types of events. And the striking thing about this event is that most of these excess deaths were in the community. So we did have small increases in acute care facilities and residential care facilities, but almost 200% increase in the community setting. And I just want to point out that, we saw increases among all people over the age of 50 in absolute terms. It was the most elderly that had the highest impact, but in relative terms, we saw, again, almost a doubling of mortality in all age groups over 50 during this event. And, we know that these community deaths occur because of very high indoor temperatures, and that has been a very large focus of the work that we've done together in the province since this event. So this is data from Abbotsford, again, that community that's a little bit further east of Vancouver and a little bit hotter. The black line shows you the temperatures measured at Abbotsford International Airport during the event. You can see day after day increases in those hot temperatures. The blue line is from a home with central air conditioning. There is very little impact of the outdoor event on the comfort and safety of the indoor environment here. And the red line is from a home without air conditioning. And as you can see, just these increases day over day in temperatures in that home till they're at a maximum of almost 40 degrees C. And I've blocked this out in different colors because it's the temperature thresholds we've been using to communicate about indoor temperature risk. In this yellow area here, we would say there's elevated risk for the most susceptible people. And in this orange zone here, we would say that those temperatures are potentially dangerous for susceptible populations. And this home is in that dangerous temperature threshold for almost 4 full days. Question number 3, what was the biggest risk factor for death during the 2021 heat dome in BC? Great, I'll stop it there because you've demonstrated my point very nicely. Without further information, most people go to cardiovascular disease, some go to mental illness, and chronic kidney disease is trailing in third there. This was a bit of a trick question in that when we do our analyses, we actually find that poverty was the biggest risk factor for death during this event. So I'm not going to go into all the details of this study, but when we look at our pharmaceutical data, we can see that people who are receiving income assistance in the province under Plan C were at higher risk of death than anyone due to these chronic diseases. But then when we look at these chronic conditions, we see that schizophrenia was the biggest risk factor, followed by COPD, Parkinsonism, heart failure, chronic kidney disease, and these other conditions. But I think a lot of the time there's this instinct that cardiovascular disease is the biggest risk factor. We're often told that it's the biggest risk factor, but when we look at the data, it might not actually play out that way. So this was not a good time in BC. It was not a good time for me. It has really changed my career fundamentally and the way I think about extreme heat. And not long after the event, I was in a meeting with a few higher ups in the province who wanted to know why things had gone so wrong. And I, said, based on that email I showed you a snippet of earlier, and other communications, like, we were doing our best to try to communicate with you that something very dangerous was going to happen. It was mid-pandemic, which did not make things easier when it came to public health communications. And someone very important in the province told me to shout louder next time. And although that was a nasty thing to say, it really has motivated the way that we've approached extreme heat in the province since then. So in the summer of 2022, we launched a pilot version of the BC Provincial Heat Alert and Response System. And this brings elements of what we were doing prior to 2021 together and puts them all under ECCC as our partner in this work. And we now have something called a heat warning, which is what we've always had since 2018. This is hot weather. There is an increased risk of mortality, a moderate increased risk. We expect a few heat warnings per season. And then we have another level called an extreme heat emergency. And this means there's a very high public health risk. It is going to be dangerously hot. We expect, based on history, to see 1 to 2 of these per decade. Question number 4, in the event of another heat dome in BC, would we issue a broadcast intrusive alert to all cell phones, radio, and TV stations in the province? Great, thank you. So, as I say, I've been on a quest to have a way to shout louder next time with many other dedicated partners in the province. And the answer to this question is maybe. We have the opportunity to use broadcast intrusive alerting if we need it. We would only use it if we saw that we were needing it. So if we had met the conditions for an extreme heat emergency, but we could see things are going well in emergency services, in ambulance services, and everything seems okay, we wouldn't hit that button. But if we can see that we're in these conditions and things are starting to go off the rails, yeah, we would be using this type of alert to reach out to everyone in the province and let them know that something very dangerous is happening. And just to show you, this is a figure that I love, the difference between a heat warning and extreme heat emergency. So a heat warning, again, is kind of regular heat. It's above seasonal norms. There is some risk, but when an extreme heat emergency, what we've found the signature is that day over day increase in temperatures that's lasting for 3 or more days. So that's the distinction between kind of a run-of-the-mill hot weather event and something potentially deadly. I want to go back a little bit and talk about what we know about how these warnings are working in the province. I can't go into all of the details about how we do this, but essentially we look at excess deaths across the province when there are heat warning or extreme heat emergency criteria have been met, simply using the observed temperatures when we have them. And I want to focus on what's been happening with heat warnings over the last few years. So in 2020, we had significant excess mortality on heat warning days. That was reduced a little bit in 2021 because most of them are sitting over here in the extreme heat emergency category. And then in 2022, we went into deficit excess mortality and an even bigger deficit in 2023. So, this to us is some evidence that these heat warnings are having an effect, and we want to protect the population from excess mortality on extremely hot days. We don't actually need the population to go into deficit mortality. So we're seeing some indicators that maybe we can increase the thresholds a little bit for our warnings. Also, this is from the summer of 2021. And you can see that, we had one very long heat warning. We had quite a few heat warnings. We don't want to get into a situation where we have warning fatigue in the population. So this is work that's being done by MSc student Alexi, who's on the line, and we are reevaluating the thresholds for the province. And some of the things I can tell you is that based on this reevaluation, we now have room to increase the high temperature thresholds by 1 degree across the province. There's a one place where we can also increase the low temperature threshold by 1 degree. However, we're seeing that the impacts are much higher in early summer than in late summer, and we're trying to establish with ECCC whether or not we can go to a 2-tier system where we have different criteria at different points of the summer. That's not happening anywhere else in Canada right now. And I just want to emphasize that, if we could make these decisions only on a public health basis, it would be very simple. But there's so many partners involved and so many folks who have to work together to make an effective early warning system that it's just not that nimble. So it may be that, we can make the recommendation to different alerts at different times of the summer for 2024, but we're not able to implement it until 2025 or later. And that's all I have for you today. I'm going to be happy to answer any questions in person or in the chat. Thank you very much.
Thank you so much. That was really informative and a great presentation. I really appreciate it.
We're thankful to folks who are doing on the fly Celsius to Fahrenheit calculations for me in the chat. I appreciate it.
And we have disabled chat to the participants, but we have a question and answer window open. So we do have one question for you about a published reference, and you can answer that in the Q&A section, and you can keep your question and answers rolling. We'll have live question and answers at the end of the webinar after all 3 presentations, but we'll continue with this electronic version. So I'd like to present my colleagues in Seattle, King County, Reid Wolcott and Addison Houston for the next presentation.
Hi, thanks so much for having us today. I'm Reid Wolcott. I'm the warning coordination meteorologist at the National Weather Service in Seattle, and I'll let Addison introduce himself real quick.
Good afternoon, everyone. My name is Addison Houston. I'm the climate adaptation strategist with Public Health Seattle King County.
So yeah, today we're going to speak briefly on the development of an extreme heat decision-making framework. So taking that forecast and the metrics that are used by, in the US, the National Weather Service, and applying those to the public health and emergency management type decisions that need to be made out in the field. So this all stemmed from, like everybody else that's speaking today, the June 2021 heat dome event. A year after that heat dome event, we held an extreme heat workshop hosted at the National Weather Service, and there was a lot of different outcomes from that. I'm not going to go over all of those today, but we very quickly realized in order to make substantial progress to help protect lives and properties that we couldn't do it alone, and that we would need to have the help of our partners, especially in public health, because extreme heat is not just a weather emergency, it is a public health emergency as well. So our first connection there was with Public Health Seattle and King County. I always like to show this Dunning-Kruger effect because this is something that as meteorologists we tend to fall into sometimes. We learn a little bit about something and we think we're experts, but it's very easy then to fall into the valley of despair or die at the peak of Mount Stupid if you don't continue to improve your knowledge in a particular area. So it's really important to reach out to your partners and gain some competence in what you're actually doing. So that's what we did. We reached out to Public Health Seattle King County and worked with them to on what types of metrics we should use to develop heat response plans, if you will. And out of that, I don't know if Addison, if you want to talk a little bit about the first draft real quick.
Yeah, so I have to give credit to my colleague who is not present here today, JJ Edge, who did a lot of the work on behalf of public health with our preparedness program. However, in this first draft, when we were first trying to go about identifying thresholds for recommendations for how to or when to activate response efforts for extreme heat event, we were really struggling with the number of different indices and metrics that are out there. A lot of our jurisdictions use temperature and duration thresholds, so that created a lot of confusion across the jurisdictions and just the lack of coordination and approach. And Reid thankfully corrected us into a proper direction.
Yeah, so I'm going to really briefly summarize the metrics that are used across the United States. So the three primary metrics that are used by the Weather Service in the U.S. are heat index, which is much like the humidex that was mentioned previously, the wet bulb globe temperature, and then the heat risk system. So heat index is a useful. It's the apparent temperature. It's what the body feels when you combine humidity and air temperature together. However, its use in the Western US in particular is not all that useful because we don't typically experience a lot of humidity when we have extreme heat events. It also, when we have heat events, our overnight temperatures tend to be even more important because of the lack of access to air conditioning, also mentioned in the previous presentation. Then we also have the wet bulb globe temperature. This is a very useful metric that that takes into account temperature, humidity, wind speed, solar radiation on the human body. But it's a very hyper localized and specific metric that is typically, there's thresholds for it for acclimatized, healthy, and physically active people. So those in the military, outdoor workers, marching bands, athletes, etc. You can have some very specific applications where it's very useful and can protect life and property, but it doesn't apply well to the broader community, the broader population. So here in the Western US, we don't really utilize heat index or wet bulb globe temperature for broad messaging or broad level decision making. What we do use is the National Weather Service's heat risk system, which is meant to put heat into an actionable, impacts-based context to provide decision making at a very localized level. And heat index is really nice because it takes into account all sorts of different parameters, including the location, the time of year. We know that a heat event in May, at 90 degrees will have a much more significant impact than a 90-degree day would in the middle of August, when everybody's kind of used to the heat by that point. And we also know that a 90-degree day in Seattle is going to have a much more significant impact than it would a 90-degree day down in Phoenix. We also take into account the daytime high temperature and, importantly, that overnight low temperature, especially for those that don't have access to air conditioning. It does take into account the event duration, and it ties all of that data back to CDC heat health thresholds, heat health data, to identify different populations that are at risk at a given level of heat. So you end up with this tiered system going from green to yellow to orange, red, and magenta, with increasing impacts and increasing portions of the population that are impacted at these different levels. And so this is much like the air quality index in that you can define different actions based off of the different thresholds. So now I'll pass it over to Addison to talk a little bit about how they're using this to inform decision making.
Hey, thank you, Reid. As I mentioned just a moment ago, one of the challenges we really faced was the lack of regional consistent approaches into when to implement our response actions, such as making cooling centers available or doing other services to get resources out into our communities. Everyone in King County, all the different municipalities that we have, were really using a different approach. So when we connected with Reid and found out about the heat risk, it really made sense to adopt the heat risk as that trigger tool, one with the ease of communicating using a simple numerical and color-coded risk categories that are very in line with existing tools that people are already familiar with, such as the air quality index, like Reid mentioned. And one of the best capabilities that the heat risk enables is really locations to understand what their unique risk is. So a lot of the times when the forecast gets put out, it's the entire region, or it's looking at one weather temperature for the Seattle area, which includes almost everything in King County. So with the heat risk, it allows jurisdictions to really understand what is their unique risk with heat and align that with these heat risk categories so we can have coordination and response thresholds. So everyone's on the same sheet of music using the same triggers, but those triggers may vary, or those conditions may vary from jurisdiction to jurisdiction. So this really enables that hyper-local decision-making framework for a coordinated response effort across the region. So irregardless of where you are, you're using the same heat risk indicators to know when action should be taken. And I love Sarah made the great point. If public health can go at it alone, it becomes a lot simpler process. There are challenges with that though, because we are in this place of providing recommendations. Public health, we ourselves do not necessarily, we don't operate cooling centers. We aren't the leads for a lot of the response actions that are necessary to protect our communities. But what we can do is leverage the expertise that we have to help coordinate and provide recommendations for jurisdictions to understand when certain actions should be taken. So that was really the approach we took with developing our public health recommendations for extreme heat. Go ahead to the next slide.
Do you want me to launch your poll question here?
Oh, yeah, sure.
All
I
right.
forgot about the poll.
Yeah. So go ahead.
Quick question for the poll. Does your region have a coordinated activation threshold for responding to extreme heat events? Go ahead and give it here a moment. And it looks like answers are starting to stabilize. So I will go ahead and end this poll and share the results. And yeah, so about 50% or 56% of people said yes. That means there's a large margin that really don't have that coordination or are unaware if there is a coordinated system. And this is one of the values that we're continuing to raise and try to promote, the adoption of heat risk index, or the heat risk tool, especially in Western states that we are interacting with here in the United States. All right, we'll go ahead and stop sharing that and go to the next slide. So as we developed our public health recommendations, we really thought, or we tried to align it with the heat risk and really recognizing that ramp up that's necessary for getting information out from a communication standpoint when we need to start advising people that, hey, something's on the horizon. We need to start getting messaging out, and looking at the resources that are necessary for mobilizing and activating things like cooling centers or doing resource distribution. There's a ton of effort that goes into those actions. So we tried to set the threshold really at that moderate heat risk category and really direct people to start looking at the heat risk and pay attention to see, like, is this heat event, is it on an upward trajectory and going towards major heat risk or extreme heat risk, or is this just a brief moderate heat event, which then is dropping back down into lesser conditions or conditions that are less of a concern? So we kind of balance the use of heat risk continuously, but we have a lot of our early warning set at that moderate heat risk category to really get people to start paying attention, consider what's going to be necessary if you are going to need to mobilize resources and staffing to support some of these operations. And then vast majority of our recommendations actually do start taking place when we get into that major heat risk category. And that's when we're starting to really recommend the activation of daytime cooling centers, evening cooling centers for people who are experiencing homelessness, as well as general population shelters. And then recommending cancellation of outdoor events or youth activities, especially athletic practices and games, things that can result in undue exposure of our populations to conditions that we know are likely to pose a health impact. Again, being in public health, we are really in this place of cushioning as recommending and considering, acknowledging that, jurisdictions do still struggle with having some of the resources and the infrastructure, especially cooling infrastructure, that is necessary for taking some of these actions. So part of this is also on the end of trying to get our response partners up to speed and recognizing, how often are these things likely to start occurring as we look out with climate projections, and start thinking about what are the resource needs and the planning capital improvement needs to start getting ahead of these events and making sure we have that infrastructure, those systems in place, the staff mobilization and resources to support when we reach that major heat risk category. Go ahead for the next slide. We also use the heat risk to inform our own internal actions as a public health agency, primarily looking at, again, public information when we're getting information out to communities, as well as some of our monitoring and surveillance. So when heat risk reaches that red category, we're starting to actively monitor our EMS and syndromic surveillance databases to see if there's upticks or any impacts to our populations that we can then roll back into how we're planning for our internal response efforts, as well as looking at how we're supporting other jurisdictional partners with reaching at-risk populations with key resources or information. Unfortunately, back in 2021, we had a lot more resources at the public health department that were in part due to the COVID pandemic that have since gone away or dissipated. So we are still trying to look at how do we continue to support providing some of these key resources to at-risk populations, and particularly people experiencing homelessness, as well as getting information and guidance out to outdoor workers. Go ahead, next slide. And just continuing to go in on the implementation and adoption efforts of the heat risk and our public health recommendations, is we're trying to continue to raise partner awareness of heat risk and promote its adoption. Even though we've done this work now with National Weather Service, we're still occasionally seeing partners develop heat response plans on their own without the awareness of the heat risk or the public health recommendations that we've developed. So we're continuing to do those engagements and trying to promote people to utilize heat risk for their own decision making. And then another part is really reaching out and engaging with those partners that are outside of that traditional emergency management realm. So a lot of the actions that we have, or a lot of the recommendations that we have, are really oriented towards outdoor event organizers, youth camp organizers, athletic activities, as well as schools. So trying to reach those partners that aren't traditionally in that fold of emergency management. And that's been an ongoing effort to try to make sure that we have those connections in place so they can be taking or planning contingency actions for their programming. And then, as I mentioned, we're continuing to navigate the resource support needs for additional requirements to help support our jurisdictions with implementing the public health recommendations that we've developed. We recognize there's a lot that goes into this, from the capital improvement needs for expanding cooling infrastructure to also those resources that we can try to get out during an extreme heat event that can help reduce the adverse impacts to our populations. And go ahead for the next slide, and I'll pass it back to Reid.
All right. Yeah. So the partner feedback from this work, this framework that was developed for the extreme heat, has been overwhelmingly positive from those partners that were in King County, and has since expanded to several other counties here in Western Washington. And I also know that the Washington State Department of Health is also utilizing this framework in their own specific ways as well. So based on that, we've started to explore expanding this framework to other hazards beyond heat. I'm not going to go into a lot of details on that, but cold, wildfire, et cetera. We've been looking at those, and I know there's one for wildfire smoke as well now. And we're also expanding this to other partnerships. So we've partnered with the King County Regional Homelessness Authority to have a similar type of framework for their individual response for their area of responsibility within King County, because their needs are definitely different than the needs of a typical emergency manager or public health agency. So overwhelming positive feedback on these. We get a lot of, when I go out to meetings, people will approach Addison and I or JJ and I and say, when are you going to come out with the cold one? We want the cold one. So we're working on those things. It's a different beast, but we're excited to continue this work as resources allow. Anything else that you wanted to wrap up with, Addison?
I think that is good for now. I see a couple of questions coming in, so we'll try to get to those in the chat or bring them back to discussion as we in the rest of the presentations.
All right. Thanks so much for having us.
Yeah, thank you so much. I really appreciate it. And I did share some of the resources that that King County is sharing online that Addison had displayed. So again, we are holding questions and answers in the live format until the end after all three groups have presented. But you can go to the Q&A in the Zoom and type your questions, and those are being answered in real time. So please use the Q&A. The chat has been turned off for folks other than the co-hosts. So we are sharing information through that, but the Q&A is where you can be more interactive. So the third presentation is from Multnomah, Portland in Oregon, and I'll let Julie take it from here.
Great. Hi, everybody. I'm Julie Sullivan-Springhetti. I'm the Communications Director at Multnomah County. I'm coming to you from the ancestral lands of the Multnomah, Kathlamet, Clackamas, Chinook, Tualatin, and Kayapua, and the Lala tribes. And I want to acknowledge that. Last Friday, the county declared a state of emergency. So Portland is the county seat, right? So the county declared a state of emergency due to a winter storm coming in, and the temperatures, unlike the heat dome, were going to be 20 degrees the other way, 20 degrees colder. And since last Friday, we opened a record number of 24/7 shelters for people experiencing homelessness. 12 shelters, that's a 50% increase from any previous number we had done before. We opened them for 5 nights. We broke the record for the number of people sheltered every night. We brought in 1,269 people the last night. We provided the most record number of rides, saw a record number of carbon monoxide illness, cold-related illness. We had the most 911 calls since the heat dome. So what I'm going to talk to you about today are the communication lessons that we've learned between the heat dome event and this one. And those lessons and the things I'm going to talk about are really central, I think, have become our standard operating procedure that we've used for wildfires, for smoke, for heat and cold. And to hear the Weather Service is even contemplating some cold weather thresholds to help us with our cold weather thresholds, I'm just thrilled to hear about. What I feel like I am an unusual guest at a webinar like this because I come from a communications background, but the information that you're talking about in the early warning system, we put into action. And in this cold event, we did it since Friday. We had issued 22 press releases, did 17 in-person press conferences or in-person media availables, issued at least 60 media responses, including other interviews, and produced 94 original graphics and 108 borrowed graphics in 13 different languages. And so I'm going to talk about the lessons that we learned from the heat dome in the hat that I wore between about 8 hours after the emergency was declared. We lost power at our house. It came on 90 minutes ago. That was almost 6 days. And it's still about 40 degrees in my house and we're completely iced in. So I hope you'll bear with me. Slide 2, please. I want to take us back to where communications were back in June. On June 21st, 2021 was just a beautiful Monday. We were coming off a 3-day weekend, and the public health, public information officer and I started the week like we had all through COVID. We had a meeting with public health to discuss the top line messages for the week. This was a standard practice we developed fairly early in the pandemic, where we we really landed on what the public was going to need to hear. And sometimes that changed during the week, but we were really looking at good news, right? We were closing in on the 70% of vaccinated adults, the magic 70% that the governor needed in Oregon to lift almost all the COVID restrictions on businesses, masks, social distancing. We were also watching a regional chlorine shortage, worried about the Water Bureau in Portland. We were working on a new video on women leaving incarceration in our detention centers. We were writing an op-ed on gun violence and answering questions about the earthquake-ready Burnside Bridge. Emergency management forwarded me this little National Weather Service email forecasting that we were going to get to 100 degrees, but it was going to drop back down pretty quickly the next day. And for several years, we'd had a website called Help for When It's Hot to try to help the community get through basically what we now think of as sort of very small, short heat waves. And I knew we wanted to put some public messaging out on that. So I sent the county photographer out to get some warm weather pictures and do some general messaging. And as you can see, this picture right across from the Multnomah County building on the Willamette River was lovely. Slide 3, please. Within 48 hours, of course, the forecast and everything else changed, and we pivoted fully to get people as much heat information as possible. We issued our first press release on June 23rd, announcing life-threatening heat, the opening of cooling centers, urging residents to make a plan, identify others who needed help, and asking organizers to postpone or cancel their outdoor events. These were some of the things. I'm just going to go to the next slide because I want you to see more than read things. Over the next 3 days, our little team, which is the little team of communication professionals, created and posted 27 graphics warning of heat stroke, giving a lot of particular advice for kids, senior outdoor workers, and issuing 12 of those in languages other than English. Slide 5, please. You can take a look at some of those cooling centers. Slide 6. Of course, remembering pets. Slide 7. We produced, in addition to, and I'm going to talk a little bit about the media response. This is Dr. Jennifer Vines, our health officer, and the health officer in every one of our jurisdictions is your absolute gold mine of a source, right? We started our video production with Dr. Vines. We produced 7 heat warning videos over the course of this event and took 3,000 photos for the graphics, videos, and web pieces. We also staffed all the shelters, meeting dozens of reporters and photographers. We handled more than 160 media requests, many of them in person, in 3 days. And those requests took place in cooling centers, in the cooling shelters that had opened, and ranged from everybody from, the BBC to Willamette Week, which is our alt weekly. Next slide, please. County workers dispensing or distributing fans. Slide 9. And outreach workers handing out water and checking on the condition of folks outside. Slide 10. And when, after all of that event, the devastating reports of 69 people being found dead in those few days, we fielded all of the media for the medical examiner. Our staff called every one of the families who was involved. We contacted them to ask if they would be interested in sharing their stories. Oregon has quite, every jurisdiction has very different rules and in terms of how much the medical examiner shares or how much becomes of public interest. We wound up in several disputes with all the major media companies over the names and addresses of each of the people who died, and were ordered by both the Oregon Attorney General and the Multnomah County District Attorney to release the names and addresses. They ruled it was in the public interest that people knew where they lived, the kind of apartment they had, whether they had an air conditioning, all of that. Of course, that wasn't going to be obvious to most people, because most people were not going to go through 69 medical examiner reports. But we worked very closely with the Multnomah County Health Department, an incredible team there that did a preliminary report within, I think, less than 2 weeks of the event, and then a much deeper report in August that that we did the graphic design. We worked with them, held the press conference, and got that information to the public, calling the families, of course, to also notify them that they were going to be that their information about their loved one was going to be in the press, and also getting their cooperation with some of them who did speak to reporters, including ones whose family members were featured in, like, the New Yorker magazine, which did a really fantastic piece on the impact of the heat. So the heat dome was the first of 5 severe weather emergencies in 2021 that we responded to in this way, and more than a dozen since, including the 8-day activation that ended yesterday, and that we had another meeting on this morning because an ice storm is hitting as I speak. Slide 11, please. So people tend to think of, I think, extreme weather communications as this crisp, kind of reader-friendly, directive messages that we write, get approval for, and then translate into multiple languages and try and push out, right? And those are all very critical, but they're also just one part of what's needed. And I want to just draw your attention to something. The contraction in news media requires all of us working on these extreme weather events to assume more responsibility for breaking and maintaining crisis communications. We really are a bit of a breaking news team. And why is that? I want to talk about a systemic change just since 2011 that has happened in our world. Print, network television, radio audiences are down by more than, just tremendously. Like, who gets the paper anymore? Traffic to digital news sites are down. So even the Seattle Times, even the papers in Vancouver, fewer people are going, they're staying less time. Media, in the most recent poll, which was in November 2023 by the Pew Research Center, described their industry, and I left out my eye, there's some editing there in the dark by candlelight, as struggling and in chaos. Next slide, please. So what I want to talk about, and that didn't convert very well, so sorry about that. It's maybe even hard to look at, so I'm going to go to the next slide. Is thinking about in your organization the ways in which you can hire for the skills or find the skills to produce the kind of materials that are going to reach a broad range of the community. And we hire for skills that the media isn't there to provide. So I think everybody has communication teams. There's lots of folks with great degrees and marketing degrees and everything else. But if you, I'm going to be an advocate in every one of these spaces for hiring people who run into burning buildings, because extreme weather events are literally part and parcel, and crisis communications are part and parcel of our work at the Multnomah County Health Department and Multnomah County. And you really need people who sort of understand what the media want, can talk to them. So I think 90% of people on my team came from media. The first slide that was a little blurry there, that was a screenshot of Sarah Hurwitz, who joined us 2 years ago from a television station and is training our new climate team in environmental health on how to do interviews effectively. And then this is our deputy director, who is a was the Oregonian, the largest newspaper in the state's political editor. And this is him talking just 2 days ago to television stations during this latest activation. So I want to say that because I think we're looking for people who understand the cadence of crisis communication and emergencies, who can work long hours, who can bring some values, for the public interest and understand the ethics. Slide 14, please. So so this has been something that we've just tried to develop to be ready for, to have the staff. And so to be thinking about your early warning system, about whether you have the skills in your organization or can contract, and I don't know how contracting would work so quickly, but for print, photo, video, graphic design, and media relations. I do have to tell you that what's been incredibly effective in Multnomah County is developing your own warning system of experts. This would be trusted people who are actually watching the Weather Service maybe before those, before we get the warning system that shows the magenta is out there, or that we're in magenta and we're going to have to be opening cooling centers. In our community, we have the Joint Office of Homeless Services. There are people who run outreach teams. I can name them. Celeste Duval. She is like a canary. She has a sense for when people on the street are looking at conditions that are going to make their life extremely difficult. There are people in our senior and people with developmental and intellectual disabilities who are expert at understanding vulnerable people who may live alone or in congregate settings that might make them. And we have a great relationship where 2 days before I hear from emergency management, I hear from them. It really helps us gear up. So as an organization, thinking about getting to your communicators, not when you're going to be making the decisions, but a day or two early. Finding trusted spokespeople and experts early. If you are trying to get early warning and early warnings and warnings out to people, I think that we have found that quickly identifying who are going to be the people that are going on camera, who are going to be the trusted sources in culturally specific communities, and also maybe communities like among the houseless who are going to be, and how they're getting information. So identifying them, setting expectations for them. This isn't a one and done deal. If, as we found during the heat dome, as we found during these last 8 days, it continues until it's over, and it's not over until sort of the press says it's over. So helping your sources be ready. There are people on this call, Brendan Haggerty, who have been incredible sources for us. And then what I want to talk about is driving them to a common platform. And it's probably what Brendan wanted me to talk about, but I wanted to get us here. This help for when it's hot is we have help for when it's hot and care for when it's cold. Our organization is on Drupal, and we have a web landing page that we drive all information in the community to. And I'm going to describe why it's not to compete with the CDC. It's not to circumvent the Oregon Health Authority. What it creates is a common dynamic platform where you are updating information in real time, and so that information, one of the most difficult things we learned during COVID is that people are overwhelmed by the sources of information. And during an emergency, when elected officials at every level, when organizations at every level, from fire agencies, are trying to helpfully offer information, you really need a place where you're going to describe thresholds, if you're going to be opening, cooling, or warming shelters, how community members can volunteer and get involved. And in our case, we have found that through this website called, that's just part of the county website, Help for When It's Hot. And then we build our distribution from there. Next slide, please. These are some of our trusted spokespeople. This is Chris Voss, our emergency management director. Again, setting the expectation for daily media and press conferences or availabilities. That has been another thing I've learned over the years since the Eagle Creek fire in 2017, but it really helped us a great deal during the heat dome. Media needs a place to go to hear your messages and elevate your messages. And in the absence of bringing them together around a press conference or news availability with an expert from the beginning, or even ideally 2 or 3 days before the beginning, that you do get your message out. And what you do is you don't waste time with the people working on the response being pulled off to respond to onesies and twosies. And because the speed with which this happens, we have found, schedule the daily media press conference or availability, make it happen. It will make your lives much easier. Slide 16. This is Help for When It's Hot, the single news platform. Next slide. Slide 17. So what the single spot does, and it's not always very pretty, and it can look pretty pedantic as you're looking at it, but it's one landing page for version control. And in any heat emergency, cold emergency, what you have is you have shelters who have power outages are a part of all of extreme weather events, right? So what you have is you have warming shelters that have power outages. You have cooling shelters that have maybe a sewer backup. You can have all sorts of things. One landing page you're updating, and then the community is going there. The version control is really important for internal control too. We work in Google. I'm sure many people on this call work in Microsoft or Outlook or whatever you're in. Developing your internal system for your comms people on an internal, so that we work off one web page document. It changes in the document, and then it changes on the web. You never make a change on the web that isn't in the document. That sounds so fundamental, but I can tell you, communication folks, everybody has their own system. And I'm just telling you that in a crisis, we have learned that this just minimizes error, allows us to correct and update. Externally, it helps the community from the media to others land. The elements of Help for When It's Hot, timed updates. Every day we post basically the major action, which would be to open, say, cooling centers with all the information on where those are, a copy of flyers, understanding that there are 5,000 people in Portland who live in Portland alone, in the Multnomah County metropolitan area, who live outside. And so they have cell phones. Are they looking at their cell phones? But there are outreach workers who work in all 30, they've divided the county into 37 districts, and they leave every morning. We give them to the outreach workers. We issue them to Portland Fire, Gresham Fire, our Hope team with our Multnomah County Sheriff. They can physically hand people's information and say, hey, it's getting really, I'm sorry, it's only 40 degrees in my house still, and I'm actually shivering, so I'm sorry. They will hand them out, and then people know how they can get to the nearest center for help. It also includes an interactive map, a GIS map, that includes many, many more resources, say for cooling shelters. It would include everywhere there's a splash pad, everywhere there's a library which is air conditioned, malls that are open. And we, again, are able to update that in real time. We're working on bringing more community resources into that as well. We post our news releases there, and as you've seen, lots of news releases go out. And then we have a whole section of evergreen material. This is a lot of tips to post and print in languages other than English. If you can go to the next slide. This is obviously not about a cooling shelter, but I figured I'd show you what we used in the last, well, 2 days ago. This is a really classic, oh, sorry, I'm gonna finish one thought before I jumped my slide, but so I'm gonna just go back. To really appreciate that the help for when it's hot page. Can you go back? I'm sorry, Mary. Thank you so much. I just wanted to note the languages other than English. So I'm going to talk a lot about the way that we get information, and we have learned this, and we do it imperfectly. Every communication effort is imperfect. And I'm going to talk about how we get, how my thinking has evolved on getting messages to community members who speak languages other than English, and what we thought was effective and what we've sort of learned is much more effective. But one of the things that we can do is we can provide tips to print and post in multiple languages that we can share with way in advance with all of our community-based organizations, all our liaisons to all our faith-based leaders, and all our culturally specific media members, with a lot of those how-to messages. Now we can go to, if you would, Mary, thank you so much. And I think the important thing about the landing page and getting some of this material in there is sort of understanding how practically you can get to, information in a very quick way to the community. Again, timed updates for help for when it's hot, copies of flyers, maps, and what the top messages are. And every day during a event, and as soon as an activation is expected, we get together with leadership. That would be the health department leadership as well as county leadership. And we hear what the top 3 messages are going to be. So this week on Tuesday, warming shelter top message. Warming shelters are going to open. Next message. We've got an ice storm rolling in right now. We have a series of graphics that we're pushing out. It was yesterday we had a record number of falls, 150 911 calls on people falling down on the ice, which in cities of millions of people may not sound a lot. It's extraordinary. It's 150 times more than 150 more than you would see in a typical January day in Multnomah County. And so what you've got is messages that, again, they identified. We wanted people to know shelters were open. We wanted to know how they could move about safely. And then next slide, please. and then to check on your neighbor. So slide 22, please. Next slide. So one of the really important lessons we learned during COVID is that you can have a lot of off-the-shelf messages, and that in culturally and that are culturally specific, that are language specific, and those are all incredibly valuable. But what we learned is to reach community, you have to start with community. You have to have trusted sources from within the community who are delivering either in real time safety messages. And this is a heat safety message that was developed that we have, we basically identified anywhere from 8 to 12 languages. We identified community members who are trusted. We recorded them with a series of different messages, and then we provide those videos to the community, and through community networks, those are distributed. We also, through the health department, this last week, we had messages going out in many languages other than English. They were boosted on social media. So I'm not going to see them in the kind of social media I'm on because I'm the wrong demographic. But people who speak Ukrainian, and the ability of the media companies to identify and really get those messages, those boosted posts to that group has been invaluable. So we're working on about 3 different levels. We're developing materials that are not that are based in community. We're using community wisdom to figure out how to talk about how that message can be heard. We're providing that to the community, and we're using sort of traditional networks to reach them, even if we're not seeing that. I hope that makes sense. And next slide, please. And this is, we're borrowing liberally. This is a King County pretty entertaining series of comics that you did all about. It's on our Help for When It's Hot. We pull them out and everything, but we're really looking at any way to try to engage and get people to see these. Next slide, please. And then I want to talk just really briefly about the wireless emergency alert systems. I know that you were talking about this. We got a lot of criticism for not using a WIA alert during the heat dome event. In a month and a half later, in August of 2021, when we had a similar, no, it wasn't even August, it was end of July, we did use them. And this was the headline in a local paper. It was, we have since developed a whole series of thresholds with the city of Portland around when a wireless emergency alert is based on whether it's going to happen within, whether people have 48 hours notice, whether they have 24 hours notice, and when you can sort of get that life-saving information out. The fact is, there were many people irritated when we did send out a wireless emergency alert and the snarky headline, that horrible shriek coming from your phone. It's the county warning you that Portland is dangerously hot. But the reality is it did reach people, and we're going to continue to use that system as a way to reach people. The heat dome and this latest cold snap were terrifying in 2 ways. From the very beginning, our health officer, Dr. Jennifer Vines, said that she was, and our public health director, current public health director, Andrea Hamburg, knew exactly what the risk was. They were worried about people outside, but they were also worried about isolated people who would be isolated in their apartments at that time, experiencing heat, and in the last week, experiencing power outages and cold. And the isolation in our communities has really proven deadly. So that has also one reason why both the wireless emergency alerts and the calls to landlines, I think, are absolutely worth any irritation that the worried well or the unworried well may experience. Next slide, please. So finally, what the final thing Help for When It Hot provides in the end, all of us are judged by how we respond to these emergencies. And disaster really goes through a cycle, right? Where, you know, at the peak of the disaster, we're all together, we're pulling together to think we're doing a good job. And as soon as it starts to lighten up, the press starts, you know, filing public records requests for all of your emails and texts, which is, of course, what happened to us 2 days after the heat dome. So what Help for When It Hot also provides is accountability. It actually provides the record of the work done, the record of the documents such as emergency declarations, the record of the actions taken. So with that, I think that may be it. Next slide is questions. And I can go to the question chat to take them. And thanks so much for inviting me.
Thank you so much, Julie. And thank you for covering the both the extreme hot and the extreme cold. It was very timely to the point that I wasn't sure if this webinar was going to happen. So I'm glad we're talking about it, and I appreciate those that direct relevance. And of course, it's extremely helpful to have a comms perspective. So we really appreciate you bringing that to this space. We are about at the 1:30 mark, and so I do want to honor anyone that has questions they want to ask live, and so we'll hold the line open after a few closing remarks, and then we can have some live Q&A if you want to stay on. But otherwise, we'll let you go, honoring the 1:30 close time. I can give a summary of next steps. Or Rachel, it sounded like you were going to maybe end this out.
Sure, I'm happy to do that. I introduced myself in the chat. I'm Resham Patel. I'm with the University of Washington, and really honored that you all joined us, and happy to work with such great folks across the region on this project. Marianne, if we have that slide upcoming, there you go, read my mind. So again, this was a topic that we had on early warning systems for extreme heat events. I think just wanted to pull forward for you that the built environment is a focus area, with our colleagues from Multnomah County taking the lead and guiding us through that conversation. And then in March, looking towards extreme heat and community partnerships, kind of as Brad mentioned earlier. So we look forward to seeing you there. And one of the things I just wanted to queue up here, maybe we can get one question in, is this idea of that timely piece between heat and cold. I thought I heard from all of our speakers who were joining today about this idea of being able to translate, and I would say, and apply these resources, strategies, and tools in various settings. So as Brad mentioned in the beginning, we've been using this heat dome scenario and the idea of extreme heat, but it's a proxy for kind of broader scenarios that we see across our region. And we have some folks joining us on the line from other parts of the country as well, and other parts of various countries as well. So I wanted to just see in closing, if our speakers wanted to share how some of the strategies that you're using, whether it's the heat index, which there's been a lively discussion about, or other strategies on communications, that folks wanted to bring up about how these thresholds and interventions could be used for cold, wildfire smoke, East Coast, West Coast, other North, South, and just kind of invite any of our speakers. Some of you touched on it, so if you wanted to expand on that, I thought that was a theme that we saw going across. I think Reid, maybe if you're, I don't know if you're still on the line, or Addison.
I'm here.
Yeah, Reid, go ahead. I thought you might want to speak to that.
Yeah. Sorry, I'm doing 6 things at once. It's been busy, like others have noted. Yeah, there was a couple of questions in the chat. One of them was about heat risk and expanding it across the U.S. And it is available across the Western U.S. At this point in time, and all across the Western U.S. That's the primary metric that the Weather Service is now using to issue any watches, warnings, or advisories. So that is the standard upon which most of the alerts from the federal agencies, at least, are coming out. And I did get confirmation talking to one of the developers that it is expected to expand nationwide in early April. It was supposed to happen last year, but for various reasons it didn't. But they are expecting it to expand across the whole country in April of 2024. So we're really excited for that to happen. There are some tweaks, I think, for the eastern part of the country that take humidity into account a little bit more. So that's an exciting development that we're looking forward to seeing how that works in other parts of the country. Again, it doesn't really impact us here in the West, but again, we've seen a lot of good work come out of the heat risk system and the development there. I know there's future work to develop things like probabilistic heat risk as well, so we can get the probability of reaching certain thresholds of heat, so you can make even more informed decisions. If you're 7 days away and it says that you're going to be in the orange category, what is the actual risk that you might end up in the red category? That might be important to know. So that is under active development as well. I know that they're also trying to take other socioeconomic factors into consideration with that after it gets expanded nationwide. So a lot of exciting development going on with heat risk, and we're really excited to see where it goes.
Excellent. Thanks, Reid. And I will just say, see if there's anyone else who wanted to add on to that. Otherwise, Brad, it looks like you might.
I just wanted to recognize it is 1:30, so I do want to thank all of our guests and a special thanks to all of our presenters. This is really helpful information. It is really truly moving us forward together, and I look forward to our next webinar. You'll hear additional information, particularly you've all registered, and so we have your email and we'll be reaching out. We'll be holding the line, but we're going to stop recording and give folks that we're planning to leave at 1:30 a moment to jump off, but we can continue the conversation.